Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, education reform continues to move center stage. We're going to talk about why that's important to you, and then the Affordable Care Act, otherwise known as Obamacare. How expensive has it become? What's going on with that big employer mandate delay? Plus, the state health care exchanges, are they up and running? All of that follows these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, joining me is Dave Patti. He's the president and CEO of the Pennsylvania Business Council and a Millersville University alum. I know something about that university, don't I, David?
Indeed. We were both there a long time ago.
Yes, we were a long time ago. All right, at any rate, look, I don't think there's any doubt that education reform, again, has moved center stage with something called Common Core standards. I want you to talk about that, and a big debate over whether or not there should be national standards versus state standards. But let's start with the basic. What's the Common Core, and why should the viewers out there care about it?
Okay. Common Core, you're right. It's part of a long history, 30, 40 years of education reform based on getting better accountability, better outcomes for the money, because Pennsylvania puts $27 billion a year into education, K-12 education, as a combination of local, state, and federal resources. The idea of Common Core was essentially twofold. One, that it should be more rigorous, and that we should know that students really can master subjects and are proficient in core subject matter, reading, writing, listening, by the way, which I think is important, as well as math, science, and civics, before they move on to post-secondary education to prepare them for a career. Right. Or for those few that will move directly to a career that they're ready to go.
Okay.
But the other thing about this was that it should be more or less even across the states. Not that the national government was going to dictate education, but that a student who comes out of a school in Pennsylvania and a student who comes out of a school in Mississippi.
So no nationalization.
It's not done by the federal government, it's done by the states, but the states working with one another.
I got it. So there's some flexibility, but there's some general principles that would get implemented about what kids would learn.
Principles is a great word because it's about standards. The curriculum will still be written by each of the 500 school districts in Pennsylvania.
Sure.
There is no state curriculum today. There still would not be. And our standards may differ somewhat from those of another state, but the governors and the chief state school officers, the Secretary of Education in our case, that they've talked to each other, they work together, and they've been doing this now since 2006. This is not something that started with the Obama administration. Right. Governor Hunt of North Carolina, a Democrat, pulled together a meeting of which the primary person was Jeb Bush, a Republican.
Does this come out of sort of the debate over No Child Left Behind? I mean,
it was very much related. And in fact, as somebody who was in the room told me, they said, look, sometime around 2005, because we weren't frankly sure that George Bush would get reelected in 2004, we all kind of went to his brother at an NGA meeting, a National Governors Association meeting, and said, is the president really serious about this whole No Child Left Behind thing, this accountability and proficiency by 2014? And Jeb said, oh, I can tell you, he's serious. Yeah. And as they start to realize they wouldn't make it, the governors came together and said, okay, we've got to step up our game.
Right, right. Well, look, here, in one way, here's the expression, here we go again. Right. I mean, every president, going back to Truman.
Oh, yeah.
Right up through, Bush 43, as we like to say, George W. Bush, have had some impetus. Why is this different?
I think it's different in that it is a bigger initiative in that all the states are doing it together at the same time.
Okay.
But I think it's also not different and not bigger, other than that now we have Twitter and talk radio, in that the standards that Pennsylvania has. We've had academic standards since 1999. And in fact, perhaps the dirty little secret of that is that we funded the development of our standards, as did all the other states, with federal money. Right. So this federal-state interplay has been going on for a long time.
All right, we're going to run to a break. When we come back, I want to ask Dave, where does it stand in the state right now? How far advanced are we? What will likely to happen? And then I'm not going to let him out here without a surprise. He doesn't know about this. I'll ask him about that in a minute. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Business Council Education Foundation. educating citizens and business leaders about important public policy issues and civic affairs. This broadcast of Pennsylvania Newsmakers is brought to you by BetterSaferRoads.com. To voice your support for safer highways and less traffic congestion, visit BetterSaferRoads.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back to the program with Dave Patti. He's the president and CEO of the Pennsylvania Business Council. We're talking about these educational standards. David, I don't think it's a topic that we don't talk enough about. If we don't have a strong education system, it's so important to economic development, to community engagement. You know more about this than I do.
The business community has been part of this and been in the room for the creation of the standards since day one back in 2005-06, as in the early days of all of this. But interesting, and for very similar reasons, so has the military. The military leaders of this country, and retired military leaders, a group called Mission Readiness, stood with me at a press conference in May because they're concerned that young people coming out of high school can't read the materials that goes with training to be a soldier these days. I mean, if you're going to be working with these advanced weapon systems, you have to be able to read and write. You have to be able to communicate to the next guys who come on duty.
Where does it stand? Where do the Common Core tell us where they stand right now in the state of Pennsylvania?
Well, Pennsylvania actually adopted the sort of national model version that came from all the governors in 2010. And what we've been working on this past year is actually modifying that a bit to be a little more Commonwealth of Pennsylvania specific, changing it a little bit here and there. To tweak them, as every state has the right to do, and then also to align them with the Keystone exams. The other states largely are getting involved with one of two national consortia to do exams to make sure that you've actually learned to master the material.
Right.
Pennsylvania had started a couple of years ago on something called Keystone exams to replace PSSAs. And what we're going to do is, rather than join these national consortia, which have a lot of legitimate questions about them, we're going to do our own thing with the Keystones and align those to the new standards and the curricula that the 500 school districts will develop based on the standards. But the idea of the Keystones is, when you're done taking Algebra 1, whatever year that is, 8th grade, 9th grade, 10th grade, you take the Algebra 1 test. If you pass, you're good. That goes in your transcript for later on for graduation. If you didn't pass the test, you get some remediation and some help right away before you move on to Algebra 2 and Geometry and other classes.
That makes a lot of sense.
Makes a lot of sense,
me.
right?
Yeah.
I mean, to us in the business community, that's what we would do.
Yeah.
If you have something that's going wrong, stop it right away. Don't wait till the end.
Yep.
And don't, for God's sakes, let them graduate from high school and then need remediation in college. That costs a lot of money.
Yeah, we've had lots of debates on college campuses about it's much more expensive to do the remediation in college than it is by getting it done.
Absolutely. Do it right the first time. And the military is saying the same thing. The Catholic Church, of course, which runs its own parochial school systems, they support Common Core and have adopted already.
I'm a product of that education.
It's great education, and so a lot of very diverse people have come together to be involved in this and say it's a good idea.
All right, I'm not going to let you go without asking you a question about the legislature and the agenda. As you know, there are three big pieces of the governor's agenda that will be debated again in the fall. We've got liquor privatization, we got roads and bridges, and we have pension reform. Of the three, and boy, have we done a number of programs on this, we spent a lot of time on this. You follow this pretty carefully. If you, crystal ball, Dave Patti, which one do you think has the best chance of passing?
I'm
not what you want.
Right. No. and I'm a little nervous about all three of them.
Yeah. Really?
I really am. I think that the transportation is the one that real normal tax-paying people don't have to be engaged in this process deeply to understand roads and bridges need to be repaired. And they're seeing bridges now being weight limited and closed, and roads that have difficulties. And I think they will put some pressure on that. And I think they understand the value proposition of, yes, I will pay more at the pump, but I will get a good road for it.
The other point about this, and we've talked about this, is the bipartisanship connected to it. Lots of these other issues fall apart Democrat-Republican, but not that.
No, that one has strong Democrat support, strong Republican support. And I respect the view of House Republican conservatives who say, well, we don't want to raise taxes and we don't want to raise the price at the pump. But it's a value proposition. What do you get for the money?
And it's a core function of government to make sure, and it's helpful to the business community, right?
It's a key to economic development in our community, just like education is.
All right, Dave Patti, he's explained a lot today, and we're going to hear now from Rob Gluss with Conrad, Siegel, Actuaries. What are we going to do about stemming the tide of rising health care costs? The Affordable Care Act has multiple parts that we're going to talk about following these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, well, welcome back. Well, I'm going to chat with Rob Gluss with Conrad, Siegel, Actuaries. We're going to talk about this never-ending debate over the Affordable Care Act and some aspects of it. Well, first of all, Rob, welcome to the program.
Thank you for having
I
me.
got to introduce you, get through the formalities so we can get to the substance, right? Look, there was a lot of debate, not so much debate, but sort of one of these perplexing glances. You did what? When they decided to put off the implementation of one aspect of the Affordable Care Act, which is the employer mandate with more than 50 employees in that part. First of all, what's the employer mandate?
Very simply, the employer mandate is a requirement that all employers who have more than 50 full-time equivalent employees are now required to offer their employees health care coverage. If they don't provide their employees health care coverage, they're subject to potential penalties from the federal government.
All right. Now, can they give our employer, if you work at a company that employs more than 50 and your employer does not have coverage now, can the employer give the employee a sum of money and say, go buy it?
Well, they can, but it's probably not the most tax-efficient way to go about doing it. You know, a lot of the pay-or-play or employer mandate is often called the pay-or-play mandate.
Right.
Well, most employers are not getting in a situation where they're deciding to say, you know what, I'm just going to pay my employees and let them go to the exchange. The exchanges are far too new. No one really knows what we're getting into with regard to the exchanges and how efficient it's going to be able to provide health care, and more importantly, how cost-effective it's going to be. It's still very effective for employers, not only from a retention tool to attract employees, but just from the perspective of a tax-efficient way to provide benefits, it's still the most efficient way to do it.
Yeah, we can talk. Yeah, I want to come back to that point because I think that's a great point. But let's pursue this a little more. Employers generally welcomed the delay if you didn't provide coverage, but a huge percentage already provide coverage. Is that right?
Yeah, certainly.
I've seen different numbers, 85, 90%. Go ahead.
Yeah, certainly large employers, for the most part, they provide coverage to their employees. Now, the trick for those employers has been where we drew the line. The employer shared responsibility penalties drew the line at 30 hours. 30 hours or more are considered full-time. Right. So a lot of employers have a lot of different employment relationships where employees could go over 30 hours that maybe they don't actually offer them benefits to.
So that's a debate point because now there's concern that, well, I worked 35 hours, I don't have coverage, now I'm going to get coverage, and the employer says, well, now you're working 29 hours or 28 hours. Is that a debate that's going on as well?
It's a great point because that's probably the biggest thing that people ask me. What was the goal of Obamacare? Right. The goal of the healthcare reform in general was to increase access to healthcare. And one way they were going to go about doing it was employer shared responsibility penalties. Well, unfortunately, for most employers, when they look at that decision, am I actually going to expand coverage to people that I wasn't offering coverage to before? Or am I better off cutting their hours back below 30? Unfortunately, that access to care has become more of a lack of access to work hours with different employers.
Yeah, that's excellent. Now, if in fact you work for a company, let's say 60 employees, 70, who cares how many, you have health care coverage now, here's the question for you. There's a big deductible in it. Does the Affordable Care Act deal with deductibles? Does it require the employer? We know about what insurance companies have to now, now a company, you have to, deal with people, who have pre-existing conditions and keep the young kid. Go ahead.
Right. Well, employer shared responsibility basically says, again, you have to provide coverage to your full-time employees. What it says is your coverage has to be minimum value, and minimum value is defined as 60% actuarial value, which I always appreciate them putting actuarial value in terms of legislation. It's really important. But it has to be 60% actuarial value, and then it has to be considered affordable. And affordability is defined as an employee does not have to pay more than 9.5% of their household income for single coverage. That's one of the really interesting nuances about it, is we're only defining affordability based on the cost of single coverage, not family coverage.
Oh, you can see this going to court. I mean, it's already in court, lots of aspects of it. All right, we're going to take a break. When I come back, these health care exchanges are complicated, and Pennsylvania is, letting the federal government do it. I'm going to let Rob talk about that when we return.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, welcome back. One of the things that, before we get into the healthcare exchanges, has to do with this so-called Cadillac tax that a lot of unions are concerned about, who represent employees, teachers and government workers, about whether they're going to have to pay a tax, if I'm using the right word, because of the high-priced insurance that they have. I mean, the high-cost insurance that the employer has to pay. I think I got that out. Help me out here.
No, that's exactly right. The Cadillac tax, or the excise tax, is a tax in 2018 is when it gets implemented. So we're looking 5 years down the road. But 5 years down the road, if you have insurance that's over certain thresholds, you're going to pay a 40% excise tax for the amount.
Well, listening to that out there, 40%?
And that's burnt money. And again, a lot of larger employers, and especially in our region here, we have a lot of public employers, a lot of collectively bargained plans. Right. We get into long-term collective bargaining agreements that may unfortunately drive out close to 2018, and we get really close to the Cadillac tax. There may have to be rather significant changes to benefit plans in order to get under that tax, assuming it gets implemented the way it's on paper right now.
Well, that's true. And the unions have reacted to this by sending letters off expressing their concern about that, correct?
I think that's correct. Again, I don't know as much about the details of that, but certainly those are the kinds of plans that are going to be affected more than most.
Now, I read recently where the average cost of health care to an employer is now about 15 grand. Do I got that about right? 15 grand, and health care costs still going up a couple of times the rate of inflation.
Certainly a couple times inflation. Now, what exactly the overall cost of healthcare is, that sounds possibly a little bit high.
A little bit high.
But certainly the rate of inflation, and the Cadillac tax in particular.
We don't want to exaggerate on here.
That's right.
But it's certainly 10, 11, 12,000. I mean, I've seen those numbers thrown around in reports that I've read.
Family coverage is not unheard of to see $20,000 a year for family coverage.
All right, let's talk about these. Pennsylvania is not setting up its own health care exchange. So if you don't have insurance out there, or your employer gives you money and says you go buy the coverage, you're going to have to get on these exchanges that are supposed to be, I won't say a lottery, but you'll get in there and there'll be all these health care plans, right? And you'll be pick one. How in that? Well, first of all, how's anyone going to understand that?
Well, it's going to be a challenge. I mean, I don't think an online marketplace to shop for things is necessarily a new structure for anyone.
Good point.
So they're hoping to make it more like people are used to shopping. People shop online predominantly now, and having a marketplace to shop is a good thing. But that's not where the value of the insurance comes in with the exchanges. The value of going to get coverage in an exchange is about the federal subsidies that are going to be there. The government is going to subsidize people below 400% of the federal poverty level.
Right.
When you go to the marketplace, you're going to have these plans to choose from. And certainly the cost of those plans is going to be an issue. Costs are probably going to rise for those.
And what's covered by the plans?
What's covered is defined. The government has kind of created, essential health benefits that all the health plans and the exchanges are required to cover. Now, that doesn't mean there's not going to be higher deductibles and co-pays and things like that.
Let's sort of go through this. So you're going to go online and you're going to pick a health care plan. You're going to have to decide what type of coverage you want, how much you're willing to pay in addition to the subsidy that you get. Is that correct?
Well, that's correct. Again, you're going to go to an exchange and they're going to have metal tiers. And they're going to say you can either have a bronze plan, a silver plan, a gold plan, or a platinum plan. And again, the price is obviously going to be higher for the richer benefit plans. Then they're going to look at your income level and determine what kind of subsidies are you going to be eligible for based on your income level. So those are the decisions people are going to go in there and try to make. And again, you can imagine one of the biggest challenges of Obamacare or health care reform is the administrative complexity and how everyone's going to understand, not only when they go to the exchange and how it's going to work, but functionally just getting them up and running and making sure all the information is available is going to be a challenge.
Yeah, one of the concerns that I've heard expressed about it has to do with how all of this is going to be paid for if they're going to provide subsidies. That's, the numbers you hear again vary, but we could be talking about 15 million people who, won't be eligible for Medicaid, who will be maybe shopping around. And so if the government's providing a subsidy, that means someone has to pay for it. The cost of this has been shifted to young people who are now going to buy the coverage, some of whom will not have the subsidy because of their income levels, and that's supposed to pay for the people we're covering. Now, as an actuary, you're grinning. What are your thoughts about how that dynamic works?
I mean, it really is. When you think about it, we want to create access to health care, especially for people who didn't have access before, which are generally your older, less healthy people. In order to drive the premium down for those people, unfortunately, in a system where there's only so much money, I have to drive the premium up for other people, and those are generally your younger, healthy.
Your young immortals?
Young immortals, unfortunately, are in theory going to have to pay more. Now, again, it's all about what is the net cost after the federal subsidies that they're eligible for. Is that going to be enough to incent them into a risk pool, into an insurance market to keep the overall cost of insurance relatively level? Most people, and certainly my colleagues in the insurance companies, are certainly very nervous about that because intuitively you certainly expect those less healthy people to be the ones flooding into the risk pool, and my healthier people, the people I need to be subsidizing the cost of those folks, are probably not going to be so quick to enter the risk pool, even with the individual mandate penalties.
Yeah, I think this has been very helpful. We're out of time. I want to thank you for coming on a program. I think that what we're talking about here, as you point out, and thanks for the clarity with which you've explained this, is a very complicated implementation of a huge program, and we'll be following this throughout the next couple of years. All right, we'll see you next week for another edition of Pennsylvania Newsmakers, and as always, stay well.